Chikungunya outbreak in southern China. What you need to know. Here's a shocking reality. Over 7,000 people in southern China have fallen victim to a mosquito-borne disease so severe that it literally means that which bends you up, and this might just be the beginning. A massive health crisis is unfolding across southern China as chikungunya fever spreads at an alarming rate, creating what experts are calling the most significant outbreak the country has witnessed in nearly 20 years. The situation has become so critical that high-ranking government officials are personally intervening, while international health agencies scramble to issue travel advisories. But here's where it gets really concerning. This isn't just China's problem anymore. The unfolding crisis that has officials racing against time. The epicenter of this health emergency lies in Foshan, a bustling metropolis home to 9 million residents in Guangdong province. What started as isolated cases has exploded into a full-scale outbreak affecting thousands, with infections spilling over into neighboring cities including Guangzhou, Shenzhen, and Dongguan. The gravity of the situation became crystal clear when a vice premier made an unprecedented visit to the most affected district, issuing urgent directives to curb imported cases and prevent the spread both within and outside affected regions. Meanwhile, the U.S. Centers for Disease Control and Prevention took the unusual step of issuing travel warnings for the region, a move that speaks volumes about the international concern this outbreak has generated. And this is the part most people miss. The ripple effects are already crossing borders, with Hong Kong reporting its first imported case. Understanding the enemy. What makes chikungunya so devastating? Chikungunya isn't your typical viral infection. This mosquito-transmitted disease carries a name that originated from the Kimakonde language of southern Tanzania, literally translating to, that which bends up. The name perfectly captures the excruciating reality faced by those infected. Joint pain so severe that victims appear permanently stooped over. The culprits behind this suffering are two specific mosquito species, Aedes aegypti and Aedes albopictus. These aren't ordinary mosquitoes. They're biological weapons capable of carrying multiple deadly pathogens, including dengue and Zika viruses. Only female mosquitoes of these species can transmit the virus, making them particularly dangerous during their blood-feeding activities. What makes chikungunya particularly cruel is its symptom timeline. After being bitten by an infected mosquito, victims typically experience a deceptive calm period of 4 to 8 days before the nightmare begins. The initial symptoms, fever, fatigue, and nausea, might seem manageable, but then comes the defining characteristic: joint pain, so intense that it can persist for months or even years. Dr. Pilar Ramon Pardo, a World Health Organization clinical management advisor, painted a vivid picture of the disease's impact. People cannot move because it's so painful. There are tears in their eyes. Isn't hyperbole. It's the harsh reality of chikungunya infection. But here's a surprising fact that challenges common assumptions. Despite its devastating symptoms, chikungunya rarely kills. A comprehensive study published in Nature estimated that while approximately 35.3 million people across 180 countries contract the disease annually, only about 3,700 deaths occur, representing a mortality rate of merely 0.01%. However, infants and elderly individuals face significantly higher risks of developing severe complications. Perhaps most frustrating of all, there's currently no cure for chikungunya. Treatment focuses entirely on managing symptoms, leaving patients to endure the prolonged suffering with limited medical intervention options. A global pattern of outbreaks. Why this keeps happening? The current Chinese outbreak isn't an isolated incident. It's part of a disturbing global pattern that's been escalating for decades. Understanding this history reveals troubling trends about our vulnerability to mosquito-borne diseases. The story begins in 1952, when chikungunya was first identified in Tanzania. From there, it began its relentless march across continents, establishing footholds in various countries throughout Africa and Asia. Thailand experienced open outbreaks in 1967. followed by India in the 1970s. However, 2004 marked a turning point, when a massive outbreak originated in East Africa, specifically on Kenya's Lamu Island. The virus demonstrated its devastating potential by infecting an astounding 70% of the island's population before spreading to neighboring islands including Mauritius and Seychelles. India faced its own chikungunya catastrophe in 2006, recording nearly 1.3 million suspected infections, with Karnataka and Maharashtra provinces bearing the brunt of the outbreak. That same year, Sri Lanka joined the growing list of affected regions, and subsequent years saw the disease spreading through Southeast Asian countries like Singapore and Thailand, infecting thousands more. The situation remains critical in many regions. As of May 2025, the French island territory of La Réunion has reported over 47,500 cases, with sustained high transmission continuing since the outbreak began in 2024, according to WHO reports. The United States experienced its wake-up call in 2014 when the first locally acquired cases appeared in Florida, Texas, Puerto Rico, and the U.S. Virgin Islands. By 2015, chikungunya had become serious enough to warrant classification as a nationally notifiable condition. While the WHO assessed the risk of large-scale U.S. outbreaks as low in 2016, the possibility of indigenous transmission cycles couldn't be completely ruled out. China's experience with chikungunya began with imported cases between 2010 and 2019, including notable clusters in Dongguan, Guangdong in 2010 and Ruili, Yunnan in 2019. These earlier incidents were successfully contained, making the current outbreak scale particularly alarming. #The current Chinese crisis. When containment fails. The timeline of China's current chikungunya outbreak reveals how quickly these situations can spiral out of control. The earliest confirmed symptomatic case occurred on June 16, 2025. According to the Chinese Center for Disease Control and Prevention, what started as isolated incidents has since exploded into a regional health emergency. The numbers tell a sobering story. During just 1 week, from July 27 to August 2, approximately 2,892 new local cases were reported, with a staggering 95% concentrated in Foshan. The remaining 5% scattered across other major population centers including Guangzhou, Shenzhen, Dongguan, and Zhongshan, cities that collectively house millions of residents. Chinese health officials have been transparent about the outbreak's origins, attributing it to imported cases. Liu Qiong, China CDC's chief expert in vector-borne disease control, explained the mechanism. With the virus spreading globally, imported cases have inevitably reached China. Given the established presence of local transmission vectors, particularly Aedes mosquitoes, these imported infections have fueled sustained local transmission cycles. But here's what makes this outbreak particularly challenging. Timing couldn't be worse. Kang Min, director of the Institute for Prevention and Control of Infectious Diseases at the Guangdong Provincial Center for Disease Control and Prevention, highlighted how the current flood and typhoon season has significantly boosted mosquito activity, creating ideal conditions for disease transmission, while simultaneously complicating prevention and control efforts. The Chinese government's response has been comprehensive and aggressive, drawing directly from their COVID-19 pandemic playbook. Authorities are implementing mass testing protocols, isolating infected residents, and conducting thorough disinfection operations across entire neighborhoods, measures that demonstrate the seriousness with which they're treating this outbreak. Protection strategies, what you can actually do. Facing a disease with no cure, prevention becomes absolutely critical. However, the available protection options vary significantly, depending on your location and circumstances. In China, vaccination isn't currently an option for the general public, despite the existence of vaccines elsewhere. The National Health Commission has instead focused on vector control measures, emphasizing the importance of promptly clearing mosquito breeding grounds and reducing the density of mosquito vectors. This approach includes deploying mosquito coils, repellents, nets, and other tools designed to repel, kill, and prevent mosquito encounters. The situation differs markedly in the United States, where the CDC reports that 2 vaccines against chikungunya are available and recommends vaccination for individuals traveling to high-risk areas. However, pregnant women face special considerations. They're advised to reconsider travel to affected regions and postpone vaccination until after delivery. But here's a controversial question that needs addressing. If effective vaccines exist, why aren't they being distributed globally to prevent outbreaks like the one currently devastating southern China? The disparity in vaccine availability between different countries raises uncomfortable questions about global health equity and preparedness. The bigger picture. What this outbreak really means. This chikungunya outbreak in southern China represents more than just a regional health crisis. It's a stark reminder of our global vulnerability to mosquito-borne diseases. Climate change, increased international travel, and urbanization are creating perfect conditions for these outbreaks to occur more frequently and spread more rapidly than ever before. And this raises some uncomfortable questions. Are we adequately prepared for the next mosquito-borne pandemic? Should vaccine distribution be more equitable globally? How many more outbreaks will we witness before we develop truly effective prevention strategies? What's your take on this situation? Do you think the international community is doing enough to prevent these outbreaks, or are we simply reacting to crises as they unfold? Should travelers be more concerned about mosquito-borne diseases when planning trips? And are current travel advisories sufficient to protect public health? Share your thoughts in the comments, especially if you've experienced mosquito-borne illness yourself or live in an area where these diseases are endemic. Your perspective could help others understand the real-world impact of these outbreaks beyond the statistics and official reports.